There's anger and fear in the streets of Madrid. Here at Carlos III Hospital, where a female nurse's assistant is being treated for Ebola, these healthcare workers are worried about their safety. This as revelations come to light over the hospital's handling of the first ever Ebola case in Europe.
Errors of protocol have only occurred in that doctors and workers treating the patient were not informed quickly enough if the suspected case was positive. We're talking about 2 hours to confirm. And the second problem was the time it took when we asked for the patient's transfer to Carlos III. There was more than an 8-hour delay.
The patient eventually arrived at Carlos III Hospital, and we're told she was taken to a ward that was cordoned off. The staff remain anxious. They're concerned over what they say is a lack of procedure.
There is a total lack of security, a lack of information. We don't know how to treat these patients. They have told us nothing. I personally went through the emergency room twice yesterday and have no idea if I came into contact with this person. I have no idea if I might be infecting other people, and we feel angry, powerless.
As fear spreads, health authorities are working around the clock, tracing anyone who may have come into contact with the woman. She caught the virus last month whilst treating 2 Spanish missionaries who later died of the disease after controversially being flown home from Sierra Leone and Liberia.
We have looked at all of our contacts, both familiar and professional, and we detected 22 contacts outside the hospital that will be monitored. The patient went on vacation the day after treating the doctor that came back from Liberia and did not have more contacts inside the hospital. Therefore, the contacts that we're looking at are those who treated her at the other hospital.
Union leaders representing health workers are blaming substandard equipment and a lack of training for the spread of Ebola in Spain.
The training sessions were limited to showing staff how to put on and take off individual protection suits.